Today is April 1st, 2019. This is Joanne. Hi, Joanne.
Hi.
Joanne entered the office the end of October of 2018 with left knee pain and left leg pain, as well as some low back pain. Joanne, would you like to just share a little bit what really brought you into the office and why and what your experience has been?
All right. In 2006, I was lifting something when I was bent over and twisting, so it was a twisting exercise. It was an exercise. I picked something up, didn't realize how heavy it was, and I felt a twinge in my back, low back. And I was just kind of conscious of it over the next few days. It was still there. Then I did some exercise one day, and it got worse, and I could feel like this pain down my leg. I went to bed that night, and there was all these contractions in my leg, and it was pulling my knee up toward me, and there was it was an interesting feeling, and it was painful, and I ended up at night sleeping on the floor with my legs on a chair, and tried to relax my leg in the morning and talk to my daughter, who was a massage therapist. But ultimately, I had this really bad contraction in my leg. It was excruciating, and I just went to a chiropractor. I also did some acupuncture on it. I ended up having to use crutches for a couple of weeks because I just couldn't stand on my leg. At a certain point, I had had some a massage, and then I went into the bathtub, and when I got out of the bathtub, I could feel like a shift, like my kneecap had been pulled out. It had been like misaligned, and then it went back into place. So that helped my walking, but it was not
Normal?
at all, not at all. It was, and so over the years since then, I've kind of struggled with walking very much. There sometimes when my health was better, but it almost felt like all my connective tissue in this leg was contracted and twisted from that injury.
2013 then?
2013, I was seeing a doctor. He said that I had low cartilage in the knee, and that inside of the knee where that injury was. He said that there was a torn meniscus, and he suggested that I have an arthroscopic surgery. I will have to say that every night since 2016, I would wake up in the night multiple times with really bad pain in my knee and in my back. It got better over time, a little bit better. Anyway, I had that knee surgery in 2013, and it basically didn't do anything. I mean, there might have been just a touch that it made something better, but I really walked into the office and walked out of the office the same way that I was. I was pretty frustrated with that.
So 5 years went by until October of last year.
Right.
And why don't you share what level of difficulty you were having when you came to the office?
I still couldn't walk very far without knowing I'm going to be in a lot of pain, or that I'm going to have to stop, or I could feel like these contractions in my leg. So it really did limit what I could do. I didn't. I used to walk all the time, and I just didn't, because that was a problem. I tried to do other types of exercise, do yoga and that type of thing, did other body work to try to help my body. I've had many other things that I purchased at home to help myself. But I heard about you in October, in September. I came down and talked to you. I heard about the protocol for the knee, and I'd also looked into trying to get stem cells, thinking, do I want to do that? And it just didn't seem like it was kind of a hit or miss type of thing. I didn't really want to spend a bunch of money for something that wasn't going to work, or maybe wouldn't work. I knew that there was much more happening in my leg than just that I didn't have cartilage there. I needed to have that taken care of. So then when you told me about your method of using supplements and the chiro and some of the other things
Body work.
did, the body work for me, I decided I would do that. And
What's happened?
My mobility is much better. I was pretty surprised at how affected I was by some of the work that you did on me, I didn't realize at the time that besides my knee, there was an ankle issue that I had that I used to have an ankle problem, but then it went away, so I thought it was fine, and actually my ankle was frozen in a position, and that was causing part of my knee problem.
Can I just interject something?
Sure.
Yeah, so part of Joanne's situation was the continuing stress in her knee and irritation in her knee, in part was being contributed to because of the severe loss of mobility that she had developed in her left ankle joint. And apart from correcting her ankle dysfunction, there was no way we were going to actually improve her knee function. So what we had to do is be aggressive both with correction of the biomechanical issues in her left ankle, simultaneously balancing the musculature and function of her left knee joint and hip joint, as well as her low back. True?
Mm-hmm.
Go
Yes.
ahead. So what's happened? I mean, what % of normal are you?
Well, probably, we were talking today, maybe around 85%. I feel really good. I'm much more mobile, going, doing things, getting down on the floor, standing up, walking upstairs. So and then like I can just walk to the park if I want to. It's not gonna think. I don't think that I'm gonna have a problem. I'm gonna feel contractions in my leg. There's no way without all of the other things that you did that I would be able to do what I've been doing now.
So we started in October, and you made a pretty significant commitment because you were coming. How far away were you traveling? 2 to 3 days a week?
Well, it's a 50-minute drive, about an hour drive.
About an hour drive, and Joanne has been very faithful in basically following the treatment recommendations, which was 3 times a week for 3 months easily, and we've cut back recently because you've been improving. So anything else, Joanne, you would share? Do you have any advice for future patients?
I guess I would say that sometimes you maybe have one issue, you think it's in your knee, and it could be a whole battery of things that are happening in your body. It's not so simple as just getting a knee replacement, because my body would have still been
Your ankle
affected.
still would have been
My ankle
froze.
would have been that way. My connective tissue would have been there. The other thing is when I had that the knee surgery, the tissue around my knee was so excruciatingly painful for a long time.
Inflamed.
Couldn't kneel on my knee. It was so painful, and I had to do a lot of work to just bring feeling back into my knee. So, and that was the easy procedure, the simple, using just the arthroscopic. I didn't want to do anything with knee replacement.
That's a great recommendation. Joanne, do I have your permission to share this great story with doctors, students, or patients anywhere?
Yes.
Any restriction on that?
No.
Thank you so much for just taking a minute to share your story. Great job, great work.
You're a great doctor.
Thank you.
Okay.